Hi, my name is Ethan, and I'm a student nurse at Swinburne University. And today I will be taking your oral health assessment. Is it okay if I record this video?
Yes, you have my consent for that.
Okay. So what is your full name?
My name is Ross Liu,
Rust Lu. What is your date of birth?
19th of May 2004.
Yeah. Okay. And is this your correct address?
Yes, that is.
Okay. So, is it okay if I ask you a few questions about your medical history? Things such as allergies, medication, family and social life, etc.
Yeah,
Yeah?
that's all right.
Okay. Um, okay. Um, so what brings you to the health clinic today?
I have come in today feeling tremendous amount of chest pain
Yep.
whenever I'm just breathing normally or breathing in heavy, light,
Yep.
everything else.
Okay, so is there any pain while you're breathing?
Yes, just it's like when I'm just regular breathing, I have like a light sense of discomfort in my
Yep.
lungs.
So light sense of discomfort. So does it like hurt when you're breathing? Like, does it take does it hurt more when you're taking a deep breath?
Yes, actually
Yes.
it does. So when I'm taking a deep breath, like in the morning when I'm waking up, I just have this like sharp pain in my chest, just in my left or my right lung.
So even just from waking up, like just normal day, every life, when you're just breathing normally and you like having to take a deep breath, does it hurt?
Yes, severe discomfort. Sometimes I feel nauseated from that, and I just don't know what I need to do to fix that.
Okay. Have you been coughing up anything such as blood or phlegm, yellow phlegm?
Um, once a week at least, I just cough up blood, just get a lot of phlegm throughout the day that I just need to spit out.
Is it yellow phlegm?
Yeah.
Yellow phlegm?
Also has taste to it that I don't really like.
Okay, okay. So is it affecting your sleeping at all?
Sometimes just throughout the night I'll just wake up and I'm like breathing heavily, like I just don't breathe at night sometimes.
Okay. So how would you describe the pain? Would the pain be sharp? Would it be tight? What kind of pain is it?
Overall I got a tight sense in like my lungs, so just always tight, feels quite claustrophobic, and then just throughout the day sometimes I just get a random sharp chest pain.
Okay, so random sharp chest pains. Okay. And where do you feel these sharp chest pains?
Just throughout my lungs anywhere.
Throughout your lungs? Any specific place?
Mainly just like around this area.
Yep. Okay. Okay. So left side of chest, you would
Yeah,
say.
correct.
Okay. And how often does this pain occur?
Like as we're speaking right now, just little bit of discomfort during heavy activity, like skating, running, like
Yeah.
wherever I do physical like load on myself, I have to breathe a lot. That's when it actually comes out, and
So basically just physical activity,
yeah,
things like that.
interrupts me a lot throughout the day.
Yeah. Okay. So do you smoke or vape?
Yes, I smoke. I've been a smoker for roughly like 4 or 5 years.
Okay. And how often would you say you smoke now?
It's not as bad as before. I used to smoke around like a pack of cigarettes a day. Now I'm only smoking like I'd say half a pack, nearly a quarter pack a day now.
Okay. Okay. And so are there any certain activities? I know that physical activity is an activity that makes it worse, but is there any certain specific activities that make it like almost unbearable?
Um, Mainly like if when I go gym and like do weightlifting, and like I have to like have a certain breath to maintain my physical balance, then that will interrupt me. I'll just get like very shaky, and I'll just be like, I'm very unsettled because of the discomfort.
Okay, okay. So now I'm gonna be asking some other questions. Do you have any allergies to food or medication?
Um, Not in the current state. No, nothing I believe of.
Have you ever had any allergies in the past?
When I was a bit younger, I had allergies to food coloring. That's about it.
Okay, okay. And are you on any medication or prescriptions or anything right now?
Not currently, no.
Any over-the-counter medications?
Um,
No,
can't think of any.
no. Okay. So what past illnesses, like past medical history, things like that, do you think has contributed to your problem? Do you have any?
I come from a family of smokers, so I feel like that's a big genetic part of why I'm feeling this way. My grandfather suffered multiple strokes. He used to be a heavy smoker as well.
Yeah.
And now I feel like it's just a genetic thing that I'm also feeling what he is feeling, and same as my family.
Okay. Okay. When did you last eat or drink any fluids?
Around 2 hours ago.
2 hours ago. Okay. Was that just eating or did you drink as well?
I had a small meal and I had some juice.
Okay. So 2 hours ago.
Yep.
Okay. When was the last time you urinated?
Uh, 25 minutes ago.
25 minutes ago. Okay. And when was the last time you had a bowel movement?
Mm, like an hour.
An hour?
Yep.
Okay. Okay. So what events happened before you felt like your chest pain, things like that?
Um, Before I had any discomfort, I was just like, I was on a run, and then just all of a sudden, I just started getting this very tight feeling and a chest pain in my left lung.
Like feeling in chest pain after having a run. Was that when was that? Was that like yesterday or
This started, I would say, like a week and a half ago.
a week and a half ago? And did this occur every single time or a couple times?
First, it wasn't as bad, and then just gradually, I just started getting worse and worse.
Okay, so gradually, so over time, it just got
Yeah,
bad. Okay. Would you say it's getting better, or would you say it's continuing to get worse?
I'd say continuing to get worse.
Okay, okay. So do you live with anyone?
I live with my mom and my dad.
Your mom and your dad.
Yep.
Okay, and do they have any family history of illnesses, like just any illnesses at all?
Um, just nah, nothing too serious. Just mainly, it's like a family thing. We have like my grandparents had a stroke on my mom's side. My dad, I mean, yeah, her dad had a stroke, and then just I feel like it's just all adding up, and I don't know what I should do about this.
Okay, okay. So I'll hand this information over to the doctor, and he will prescribe you with any medication and any further action that you have to take. But in the meantime, thank you for coming today, and I hope that I wish you best of luck. So now we will do the Pendleton model for feedback. So I think what I did well was eye contact, and I thought that my communication to you was quite clear. What do you think I did well?
You had great eye contact. You asked good questions. Um, you also just had the right way of like replying to what I was telling you,
Yeah.
and just all clicked in perfectly.
Okay. Okay. And what do you think could be improved about what I was doing?
Sometimes you gave off like a very short answer, and that may be not as good in the actual real world than what we're doing now,
Yeah.
because this is more of like a assignment, and then in the real world you will actually have to take care of people.
Yeah. Okay. Okay. And so, what's like a plan for improvement that we could do?
Um, Maybe work on your replies, because sometimes you get off the short answer,
Yeah.
and maybe like try and elaborate more and like think of what a good solution would be.
Yeah. I think that's pretty good as well.